Arden, tell me about what your company Thalamos is doing to digitalise the Mental Health Act.
So we started Thalamos last year at the beginning of 2018, and the focus has been on digitalising the Mental Health Act, which up to this point we understand is a very paper-led process, the pink forms that doctors are familiar with. And whilst they are fairly commonplace and there is a process in place to administer those forms, in paper format they're very prone to errors, and they involve a lot of manual checks to make sure that the detention of that individual is legal and that that person has received their, all of their rights. So what Thalamos is doing has created a digital means by which to complete those forms securely and in an encrypted way that allows them to be more swiftly moved from a community environment to an inpatient environment, and also allows for that form to be received by the hospital more effectively. So hopefully in time we can create a much smoother way of administering the Mental Health Act.
I gather you've been following the recommendations of the President of the Royal Society of Medicine, Dr. Simon Wesley. Do you want to say anything more about that?
Well, Sir Simon, who I was fortunate enough to meet at the Royal College of Psychiatry International Congress in July, he reviewed the Act, as we know, last year, and that review was published in December 18. He made 154 separate recommendations, of which 8 specifically focused on so-called digital enablers, tools that clinicians need in order to better support patients and service users who are coming into contact with the Mental Health Act. And particularly what he was talking about was the ability for advanced directives to be taken into consideration when somebody is being sectioned. At the moment, for a clinician in the field, it's very difficult to take into account an advanced directive, because where does that sit? Does it sit with the hospital? Does it sit with social services? How do they access those advanced directives? Obviously, it can be quite a chaotic environment. And we think that the correct application of technology and the correct use of digital tools will allow that advanced directive to be available to the clinician or the social worker at the point at which that person needs it to be taken into consideration, at the point of crisis. Now, it's not going to happen overnight, clearly, but technology, we think, can be an enabler of that and hopefully allow for some of those recommendations that came out of the review to start to be enacted.
Final question. How does your system integrate with the EPRs in hospitals and in primary practice?
So it's a great question. At the moment, the way it doesn't integrate as such. So at the moment, the way in which a section paper is received is through a secure, time-sensitive, encrypted link. So that can be received over email or into an in-hospital communication system. It could be received through a text message, for example. And then the way in which that is received is then the receiving party has to let the system know who they are and that they have the appropriate approvals to receive that form. Once they've done that, they download it as a PDF. So essentially what is happening is we're removing the paper, and they receive the already electronic statutory form in its PDF format so that they can upload it to whatever EPR system the hospital is using. That's how it stands at the moment, but by digitalising the paper process, what we can actually do is build what's so-called API, which would allow that information to be directly into the electronic patient record, so that actually you're kind of removing a manual process, and that before the individual arrives on the ward, the professionals on the ward would already have access to all of the paper. So that is how we see the future, but at the moment it's a secure and encrypted time-sensitive link.